GERD and heartburn are actually not the same thing. Heartburn is the difference between the two for real is you may get similar symptoms between the two, but heartburn doesn't happen as frequently. Heartburn usually is an occasional thing. Y'all, hope y'all doing marvelous, and I'm back with another video out of the nutritional basis of disease series. So I want to go ahead and let y'all know real quick, the allergies kind of got me this season, so if I sound a little off, or if I start sniffing a little bit, please forgive me. Now we're gonna talk about GERD. Now the reason why this is titled 302A, I'm looking at maybe an A, B, and a C for session 302. Reason being is because what I'm talking about specifically is certain disorders of the digestive system, right? So a lot of these may be gastrointestinal and otherwise, of course, digestive. So I'm looking at 3 different ones that I'm going to talk about, and GERD is the first one. So this right here is gastroesophageal reflux disease. So some of y'all may already be familiar with this. So I already wrote, this is the beginning of, the digestive system disorder subseries. GERD and heartburn are actually not the same thing. Heartburn is the difference between the two for real is you may get similar symptoms between the two, but heartburn doesn't happen as frequently. Heartburn usually is an occasional thing. With GERD though, it's more chronic. I believe, one of the criteria for it is if you're getting the symptoms, more than twice a week, then you may have what's called GERD, okay? You may have that as opposed to just regular heartburn. Certain symptoms, of course, include, and again, this is common for both, but for GERD, symptoms may include heartburn, chest pain, a chronic cough, even some trouble swallowing, or even some throat lumps. Approximately 20% of the US suffers from weekly symptoms, and those complications tend to increase with age. Now, the thing is with those complications, right, it's not so much the disease itself that increases, like that doesn't become more complicated with age, but the symptoms may. Dental caries and certain other oral conditions are closely related to GERD. I'm gonna go into a little background. So with this background, so what happens is we have what's called the LES, right? It's the lower esophageal sphincter. What that does is it acts as sort of a barrier between the esophagus and the stomach, okay? Regular atmospheric pressure is normally greater or higher in the esophagus than in the stomach. Sounds about right? Because your esophagus is a little higher than your stomach. What happens is sometimes there may be a differential in pressure, meaning sometimes pressure may drop with your esophagus, it may drop a little below your stomach. Now that's normal, okay? Like as you digest food and things like that, that is normal. But what's not normal is when it continues to happen, right? If it happens on a consistent basis, then you get what's called LES incompetence. Atmospheric pressure for your esophagus doesn't come back to where it's supposed to be. And that ends up how you start to develop GERD. That's the start of it. There are certain risk factors, okay, obviously. Increased secretion of certain hormones. Now I'm gonna go into how each of these hormones may increase, the condition. So gastrin, estrogen, and progesterone. So for those of you who don't know, these are all, of course, hormones, right? So I'm gonna go ahead and start with gastrin first, right? Now gastrin is, it's the hormone that, it's a normal hormone, right? Like gastrin is a part of your digestive system, but in excess, okay, like high levels of gastrin, it's basically an excessive amount of, stomach acid, right? Excessive secretion. So what happens is, excessive production of gastrin doesn't stop it puts a lot of strain on the LES, the sphincter. And, when your sphincter is under a severe load like that, it may, instead of processing stomach acid, it may go ahead and sort of backflow it into your esophagus, causing you heartburn or, GERD in this case. Now, estrogen, as y'all may know, is that's the female hormone, okay? It's a hormone that's utilized in the female's reproductive system. So high levels is what can cause, GERD also, or contribute to it. Estrogen, especially those as seen in pregnant women, because pregnant women, of course, tend to, increase estrogen a little bit more. High levels of estrogen, though, like extremely high levels, can relax the LES, right? So it can relax the muscle. And when the muscle is, relaxed, for longer than it's supposed to be, then of course, again, stomach acid it's just going to backflow. And the thing with estrogen though is high levels of estrogen can actually cause, it can cause an increase in nitric oxide production. And an increase in nitric oxide production will essentially relax the, lower esophageal sphincter, the LES. And, that's the thing about the LES. When it gets too relaxed for too long, it can then, cause acid to backflow up into your esophagus. So as I mentioned, the LES serves as a barrier, right, between your esophagus and your stomach. So the esophagus, the LES is, that protector. And when the LES is too relaxed, it's not going to go processing the acid the way it's supposed to. High levels of estrogen equals high levels of nitric oxide, which then equals a relaxed LES for way longer than it's supposed to. Progesterone contributes to GERD because it's a, muscle relaxant. And it being a muscle relaxant, it can weaken the LES. Then you have certain conditions like hiatal hernias, right? If you have a hiatal hernia, that's a risk factor. So let me explain this one. So a hiatal hernia, causes an, anatomical change, right? It sort of to change to your anatomy in a sense. So what happens is the hiatal hernia is it's a condition basically where like a part of your stomach protrudes through the esophagus, its thoracic cavity. Now there are two different types. You have what's called a sliding type and then a rolling type. The sliding type is basically where like, your portion of the upper stomach just kind of protrudes through the esophagus. You know what I'm saying? It just kind of like, it's usually, just kind of left at that. But the rolling may include, the type 2, that may include other parts of, your digestive system. So for example, it may include the colon. So hiatal hernias like that, can change your anatomy. Something protruding through your esophagus like that, your upper part of your stomach or what have you, moved into your, like your diaphragm or what have you, as is seen with type 1, that can cause GERD. And obviously obesity is a risk factor. Certain foods that you eat that may, lead to obesity, and I'm gonna go into that with nutrition therapy, but certain foods that you eat, can contribute to GERD, right? Contribute to obesity and then in turn contribute to GERD, exacerbating the acid reflux and making things worse. So then there's cigarette smoking. Cigarettes, they do a number on your esophagus. Then there's meds like dopamine and morphine in excess. And then of course you have foods that are high in fat, peppermint, chocolate, alcohol, and even caffeine. That in combination with, obesity, right? Foods high in fat, which, foods high in fat tends to lead you into obesity in the first place if you do that consistently. Now you have something else called Barrett's esophagus, which essentially kind of just is an exacerbated version of GERD. So with Barrett's esophagus, I went ahead and put up a diagram here, to kind of show you, a visual as to what happens when you have Barrett's esophagus. Tissue lining of the, lower esophagus, it begins to change, sort of like it gets similar to that of the, tissue lining of the intestine. So as you can kind of see in the picture, right, you have the normal cell lining in the top portion, and then you have like, it starts kind of narrowing. It may be hard to see in the bottom picture, but it kind of starts to narrow a little bit. So that's what happens with Barrett's esophagus. The tissue lining changes, okay? And it just kind of like narrows and just kind of constricts. And it's usually just a kind of a byproduct, I guess you could say, of GERD. With Barrett's esophagus, there's no real symptoms outside of those experienced by GERD in the first place. You have common medical treatments, so I wanted to write that first before going into the nutrition therapy. Mind you, again, with all of these, the treatments, they're all, of course, going to be recommended to you by doctors, depending on what it is you have and how severe the condition is. So, common medical treatments, certain meds that are used to block certain receptors, stimulatory paths for acid secretion. So some of these you may actually have heard or seen commercials of. Prilosec is definitely one of them. Nexium is certainly another. I know a few people, that used to take Nexium. And there's also Prevacid and then Protonix. So those are some of the meds that, can be used for, GERD. Okay, because what happens is those medicines are supposed to help block certain receptors. Because of course, as you know, our digestive system has receptors as well as digestive enzymes used to, help digest food and pull, certain proteins or what have you from certain foods. Pepsins is, it's not a hormone or anything, but it's a digestive enzyme. What happens is it gets activated in digestion, and it takes proteins and breaks them into the pepsins and the smaller peptides. So, but an increased though of pepsins can, of course, mess up your LES. If you secrete a lot of, the hormones and a lot of the digestive enzymes necessary, but if you secrete too much, to, enough that gives you GERD, then, medicine may come into play. That may be a factor. It may range from simple rinsing to certain oral agents that are prescribed by a doctor or a nurse practitioner. In case you don't know, I wrote dental caries and oral conditions, at the very beginning. I didn't go too much into it. It is kind of self-explanatory. So what happens with GERD, obviously, as we mentioned, as we know, stomach acid moves back up into the esophagus. It can get so far to where it actually can touch your teeth, right? Where it can come into contact with your teeth. Well, we all know what happens when stomach acid, or at least I should say most of us, know what happens when stomach acid touches your teeth. It can cause what's called enamel erosion, right? So it can rot your enamel out. And if your enamel is rotted enough over time, you can start losing teeth. Okay, you start getting dental caries, and then, more and more severe, you end up losing teeth. Then we have nutrition therapy. Now, I didn't write anything because I just kind of wanted to, talk about it as I put this here, table up. So in this table, we have what nutrition therapy may likely be followed. But first, of course, before I go into this table, there of course is going to be an evaluation and an assessment. And so they'll go over all the risk factors with you, They'll check everything you got, your history and all of that. I already went over a few of these things, what foods that they're likely going to tell you to avoid if you go see a doctor, or maybe even a nutrition coach, or a dietitian. They may tell you, to avoid peppermint, alcohol, all the things I wrote, caffeine as well, and of course foods high in fats. Now there are some other foods, as you can see in this table. Certain fruits and certain vegetables may contribute to GERD, but it depends on the individual and how bad your GERD has progressed. It also may tell you to ensure you don't take foods that are highly acidic, and also seasoning, spices, right, that are also highly acidic. Citric acid, I know, is a common staple in a lot of different seasonings, especially the dash ones that I went over in my special session, right? So they may tell you to, make sure you don't eat highly acidic foods. They may tell you that. Of course, you got some other things in here, certain dairy products, you got milk, eggs, It just depends. Certain desserts, of course, and other, like pepper. Okay, pepper is kind of that's, like I said, spices. I did mention that. Pepper is one of them. So just regular pepper can do a number on your esophagus, so, because what happens with pepper is, it'll secrete stomach acid, because of how strong pepper can be. Your system will, then to start to secrete, stomach acid in that sense. So that's some of the nutrition therapy that you may be faced with. And that is going to be it, Didn't want to make this a really long video or nothing. So not sure what session 302B will be yet, but it's going to be, another digestive tract disorder. This has been session 302A, GERD. Hopefully y'all have learned something from this video. If you deal with GERD or heartburn, heartburn is, like I said, it's usually not as big of a deal because it doesn't happen as often. But if you have GERD though, you definitely want to make sure if you have all these symptoms or any combination of these symptoms, definitely make sure you go get seen, okay? Make sure you go ahead and get, a professional's opinion. Your treatment may be nutritional, but it may be something else. I did write certain medications that they may, prescribe to you as a result. So either way, make sure you see a professional. I will see y'all on my next video. Y'all have a great rest of your day or night, whatever time it is for you. If you like this video, give it a like, comment if you have any comments, questions, or concerns. And most of all, subscribe. Thank you so much. I'll see y'all on the next one. Take care.